Now we've covered the epidermis, so let's move to the deeper layer, which is the dermis. It's composed of connective tissue and contains primarily collagen fibers, but also some elastic and reticular fibers. It's also been found that there are dendritic cells in the dermis, and those work just like the ones in the epidermis. They are a part of the immune system. Also located in the dermis, we have blood vessels, sweat glands, sebaceous glands, which are oil glands. The hair follicles are embedded within the dermis. The erector pili, you see right here, that's the muscle that attaches to the hair follicle, and when it contracts, your hair stands on end when you get goosebumps. We have the nail roots and nerve endings are located in the dermis as well. So the dermis is divided into two areas, as you can see here in this image. A very small papillary layer, which has these little finger-like projections that push up into the epidermis. The remaining part of the dermis, which is about 80%, is the reticular layer. As we look at the papillary layer, it is the most superficial part of the dermis, so it's just deep to the epidermis. It's composed primarily of areolar connective tissue, and its name is due to the papillae, or the projections of the dermis. So the dermal papillae actually are going to interlock with the epidermal ridges of the epidermis and form what basically looks like these little egg crate structures that we put on our mattresses. So this would be the dermal papillae. These would be the epidermal ridges. So this increases the contact area between these two and makes sure that they stay very firmly locked together. Now, in addition to that, the dermal papillae will also have lots of blood vessels that push upward toward the epidermis, so that some of the oxygen and nutrients and such can diffuse into that lower level of cells in the epidermis. Now we also have tactile receptors that are located in that area as well, that just continuously monitor for touch on the surface of the epidermis. Those tactile receptors and others will be covered again as we move into further chapters and begin to talk about the nervous system later on in the semester. The much larger layer of the dermis is the reticular layer. So it is below or deep to the papillary layer, and that's where most of the structures are located. So the reticular layer consists primarily of dense, irregular connective tissue with large bundles of collagen fibers that extend in all directions, as we saw when we talked about tissues in the previous chapter. So the word reticular means network, and it refers to this mesh-like arrangement of those collagen fibers. Now, we're going to talk about each of these derivatives, the structures found in the dermis individually, but I wanted to show you this picture because it really ties back into the egg crate mattress pad that we saw on the previous image. So here you can see those dermal papillae projecting upward, the epidermal ridges projecting downward, and they interlock together and form that holding together of those two different layers of tissue, with the epithelials making up the epidermis and the connective tissues making up the dermis. Now, cleavage lines are formed because of the arrangement of those collagen and elastic fibers in the skin. So they're oriented sort of in parallel bundles at specific body locations. And the alignment of these fiber bundles within the dermis is a direct result of the stress that is applied on those tissues as we move around every day. So the function of these bundles is to reduce stress. Cleavage lines in the skin identify predominantly the orientation of those collagen fiber bundles, and they're clinically and surgically important, because if you're going to do a procedure where you have to cut through the skin, if you cut perpendicular or across a cleavage line, then it's going to be pulled open as a result of the recoil of those connective tissues. That results in cut elastic fibers. This usually also will cause the incision to be very slow in healing, and it increases scarring. However, if you cut parallel to the cleavage line, then the incision will typically remain closed. So surgical procedures should be planned with the consideration of those lines of cleavage so that you can ensure a more rapid and thorough healing and prevent scarring, as you can see here in this image. So if you're going perpendicular to these cleavage lines, it's cutting the fibers, and that of course is going to cause the wound to gape open and have a much longer healing time. Whereas if you cut parallel to those lines, you are not damaging those connective tissue fibers, and the wound will heal much more quickly as it does not gape open. A couple of additional imbalances associated with the dermis includes blisters. So we've all had a blister before. Let's think about what happens there. So whether you have had excess friction because you're working in the garden, or you've burnt yourself by touching a hot eye or a hot pan, if a blister occurs, it's because you have damaged the tissue deeply enough that you have caused an inflammatory response in the dermis where those blood vessels are located. Now remember, those blood vessels do not extend through that basement membrane and get into the epidermis. So part of the inflammatory process allows fluids to leak out of blood vessels and accumulate in the tissues. Well, when it does so, in that papillary layer of the dermis, those tissues can't, or that fluid can't move through that basement membrane and up into the epidermis. So it creates a little area where the fluid is accumulating and pushing upward on that basement membrane and the epidermis, and that is what causes that blister to occur as the epidermis separates from the dermis. Now, of course, we should just poke a hole in that and let all that fluid out, right? Yeah, typically that's what happens. We either break it accidentally or we just get tired of messing with it and we poke a hole in it. Well, guys, you might as well poke a hole in your condom. You've just created a hole in your barrier. So why would you poke a hole in your blister? To allow bacteria in. Your skin will resorb that fluid. Leave it alone and don't risk infection. Another disorder or imbalance associated with the dermis is called striae. Striae are what we commonly call stretch marks. So it occurs when there's stretching of the skin due to excessive weight gain, such as with pregnancy. Now, a lot of this results because when we do gain a lot of weight like that, we exceed the capacity of those elastic fibers to stretch the skin. So when it stretches beyond what it can stand, collagen fibers are torn, and that results in stretch marks called striae. Now, you can minimize the appearance of these, but you cannot get rid of them. So don't go out and spend hundreds of dollars on those fancy creams that say, oh, just rub this on every day and you'll get rid of your stretch marks. No, you won't. The best you're going to do is minimize the appearance if you continue to use that product on a regular basis, which means more money, more money, more money. So while we're talking about the dermis, let's talk about one of my favorite things, tattoos. Yes, I have several. No, you probably won't ever see them unless you catch me at the beach. So tattoos are permanent images that are produced by injecting dye into the dermis. Now, because the dermis doesn't have a rapid cell turnover for repair and replacement, the injected dye stays in that area for a long time, and scar tissue will form around those dye granules. Now, those dye granules are too large for the dendritic cells to do their immune function and digest it away, so they simply become a permanent part of the dermal layer. Now, some people will get tattoos and then a few years later, oh darn, I don't want that name on my arm anymore. Or perhaps you just decide you don't like that particular tattoo anymore. Well, it's usually pretty impossible to completely remove it, and some scarring tends to occur when you try to. Older methods of removing tattoos might have been a little more successful, but a little more risky as well, and that includes cutting out the tattoo, or dermabrasion, which basically is like sandpaper scrubbing off the tattoo, or cryosurgery, freezing the area so that the tissue dies and then is removed. Lasers are now used in some cases to break down those tattoo pigments, and that can be done with varying levels of success depending on a lot of things. Ultimately, one of the things is how long you've had the tattoo. The older inks are much, much harder to remove, whereas the newer ones you have a little bit more success with breaking those pigments down.